Have you ever felt this? You're sleeping peacefully, and suddenly a sharp, twisting pain shoots through your calf. Your toes curl downward, your breath catches, and for a moment, you can't move. It feels as if the muscle is tightening from the inside, gripping you without warning. Many seniors tell me this is the moment they fear something is truly wrong. And if you've ever felt that sudden jolt between 2 and 5 in the morning, you're far from alone. Millions of older adults experience the same frightening wake-up call night after night. A patient once shared a story with me that still lingers in my mind. She told me she had been having these cramps for months. She tried drinking more water. She stretched before bed. She added bananas to her breakfast. She even bought new shoes, hoping it would help. But nothing changed. What she didn't know, and what many seniors don't realize, is that her cramps weren't coming from dehydration or low potassium at all. They were her body's first quiet warnings that her nerves were starting to struggle long before any numbness or tingling appeared. I want you to imagine this. Picture tiny nerve fibers in your legs, the ones responsible for sending signals between your muscles and your brain. Now imagine those nerves beginning to misfire, sending confused or exaggerated messages. Sometimes they fire when they shouldn't. Sometimes they fail to fire when needed. And before you ever feel numbness, burning, or tingling, these misfires can show up as sudden, powerful leg cramps that seem to come out of nowhere. Most people over 60 believe cramps happen because they didn't drink enough water, didn't get enough potassium, or slept in the wrong position. But for many older adults, the truth is deeper. Early nerve changes often begin long before other symptoms ever appear, and leg cramps can be one of the earliest signs. In this video, I'll walk with you through the hidden nerve damage signs seniors often overlook. You'll learn how nerves, circulation, and muscles shift naturally with age, how to recognize early red flags of neuropathy, and simple steps you can take to protect your nerve health and reduce nighttime cramping. Your body isn't failing, it's communicating. Before we move into the next part, remember to subscribe, like, and share Senior Health Daily. It helps us continue bringing life-changing information to you and the people you love. Let's begin this journey together. Why? Leg cramps often signal silent nerve damage. When seniors tell me about their leg cramps, they often describe a sudden tightening that feels as if the muscle is twisting from the inside. It happens without warning, usually in the quiet hours of the night when the body should be resting. What many people don't realize is that these episodes can be early signs of nerve irritation long before numbness or burning sensations appear. The nerves become disrupted, confused, and overly reactive, and that tension ripples down into the muscles. One of the earliest changes in aging nerves is something we call overfiring. Picture a spark plug sending signals too quickly or at the wrong time. When a small nerve fiber becomes irritated, it reacts unpredictably, and the muscle responds with a tight, painful contraction. This happens before a nerve cell dies or before full neuropathy develops. In many people, cramps are the first warning that something deeper is going on. Another factor is circulation. Nerves depend on a steady supply of oxygen-rich blood. When circulation slows even slightly, the nerve endings become more sensitive and easier to irritate. The calves, which are already far from the heart, are especially vulnerable. As blood flow declines, the nerves become more easily triggered, and the cramps grow more intense. This can happen years before anyone connects the symptoms to nerve health. I think often of a 72-year-old woman who came to me after months of nightly cramps that kept her awake. She had tried more water, more bananas, massage, and stretching, yet nothing helped. It wasn't until we checked her nerve response that we discovered she had early-stage neuropathy. She had never felt numbness or tingling. The cramps were the first sign that her nerves were struggling. These moments are never about fear. They are about understanding. When you know why something is happening inside your body, it becomes less frightening and far more manageable. Leg cramps that seem harmless or random can sometimes be quiet whispers from your nerves, asking for support long before anything severe develops. And once you learn how to support those nerves, the cramps lose their power and your nights begin to change for the better. Subtle circulation changes that seniors miss. As the years pass, circulation shifts in ways that are so quiet and gradual that most people never notice them happening. Yet these small changes have a powerful effect on the nerves in your legs, especially at night. When blood flow slows, even slightly, the nerves receive less oxygen and fewer nutrients. That creates the perfect environment for irritation, and the muscles respond with sharp, sudden cramps that feel out of proportion to the moment. The truth is that circulation doesn't decline overnight. It changes slowly and gently, often beginning with something as simple as feeling cold feet more often than before. Some seniors tell me their toes look pale or that they warm up much more slowly in the evenings. Others notice that when they press lightly on their skin, the color returns a little slower than it used to. These tiny signals are easy to overlook, yet they reveal so much about what is happening inside the blood vessels. Sitting for long periods plays a larger role than many expect. When you spend hours in the same position, your calf muscles stay still and the natural pumping action that pushes blood back toward the heart weakens. Without that movement, blood settles in the lower legs. This pooling reduces the oxygen supply to the nerves and leaves them more vulnerable to irritation, especially during sleep. Even someone who walks daily can experience nighttime pooling simply from long stretches of sitting during the day. Hydration also plays a quiet role. Some of my patients drink plenty of water, but almost all of it in the evening. By then, the body has spent the entire day slightly dehydrated, and the blood grows thicker and slower moving. One man I cared for drank 2 large bottles of water every night before bed because he thought it would prevent cramps. Instead, his cramps always hit at 3 in the morning because his nerves had been struggling all day without proper hydration. When you understand these gentle shifts in circulation, everything begins to make more sense. The body communicates one small message at a time. Cold feet, slower color changes, a little more stiffness, a cramp that wakes you from sleep. These are early whispers from your circulation and nerves asking for a bit of support. And the moment you begin giving that support, the body responds with surprising relief and strength. Before we continue, if this video is helping you understand your health, please subscribe, like, and share Senior Health Daily. It gives us the motivation to create more life-saving content for you. Neuropathy symptoms, seniors' mistake for just aging. One of the most misunderstood parts of growing older is the way nerves begin to change long before anyone realizes it. The earliest symptoms are so subtle that many seniors shrug them off, telling themselves it is just part of aging. But these tiny signals are actually the body's first attempts to communicate that the nerves are becoming irritated, stressed, or undernourished. It often begins with a light tingling in the toes. At first, it comes and goes so quickly that people barely notice it. Some describe it as a faint buzzing, like a phone vibrating far away. Others feel a soft burning sensation that warms their feet even when the room is cool. These early signs are not random. They are small whispers from the nerves that something is changing in their function. As neuropathy progresses quietly, the sensations shift. Some seniors feel sudden, sharp electric sparks that shoot through the foot or up the leg. These zaps, as many call them, often arrive without warning, and because they disappear as quickly as they arrive, people often dismiss them. They tell themselves it was probably a muscle twitch or that they slept wrong. But these moments reveal that the nerves are firing in unpredictable patterns. Even numbness can be misleading. Many seniors believe numbness is harmless because it is painless. They say their feet simply feel less awake, or like they're wrapped in cotton. But numbness is actually one of the earliest signs that nerve fibers are struggling to send clear signals. When numbness and cramps appear together, that combination almost always points to early neuropathy, even before a doctor officially names it. What makes neuropathy especially tricky is how often it blends with other sensations. A person might feel cold in the feet, even in a warm room, or they might notice the muscles around the toes curling involuntarily during sleep. The body tries to adapt to confuse signals by tightening, contracting, or overreacting. It is easy to misinterpret all of this as poor circulation, lack of potassium, or just getting older. But the reality is that the nerves are asking for attention long before damage becomes permanent. When seniors begin to understand these subtle signs, they no longer feel frightened or confused. Instead, they gain clarity. These sensations are not failures. They are invitations to take action. And once the nerves feel supported, the body often responds with remarkable improvement, sometimes within days. Why leg cramps get worse after 60? As we grow older, the body changes in quiet and surprising ways. Many seniors tell me they feel stronger in spirit than ever before, yet their legs and feet seem to behave differently than they used to. What they often do not realize is that the nerves, muscles, and circulation of the legs are all undergoing subtle shifts, and these shifts make leg cramps far more intense after age 60. One of the first changes involves muscle elasticity. Muscles naturally lose a bit of stretchiness each decade, especially in the calves and hamstrings. When a muscle becomes tighter and less flexible, it takes far less irritation for it to cramp. Something as simple as pointing the toes during sleep or stretching the legs under the covers can trigger a painful contraction. The muscle is not trying to hurt you. It is reacting to stiffness that has built up slowly over many years. The second change comes from minerals that help the nerves stay calm. After 60, the body absorbs magnesium less efficiently than before. Magnesium is one of the minerals that stabilizes nerve signals. When levels drop, nerves become jumpy and more reactive. A senior may not feel dehydrated or lacking in nutrients, but the nerves can become sensitive enough that even a slight shift in position triggers a cramp. Some describe it as the nerves having a shorter fuse. Another major factor is the gradual decline in nerve insulation. Each nerve fiber is wrapped in a protective layer that helps signals travel smoothly. With age, this layer becomes thinner, like the coating on an old electrical wire. When insulation weakens, signals begin to bounce or misfire, sending unexpected commands to the muscles. This is why cramps can strike suddenly, even during rest. The nerves are sending messages faster than the muscles can understand them. Circulation also plays a role. Blood vessels become less elastic with age. This means the flow of blood to the lower legs slows down, especially at night when the heart rate drops. Muscles that are already tight and low in oxygen become more sensitive, more restless, and more prone to seizing. Many seniors notice that cramps feel sharper and last longer after 60, but they rarely connect this to slow nighttime circulation. Stress adds another layer to the picture. When we are stressed, even mildly, the body releases hormones that reduce magnesium levels and increase nerve excitability. Seniors often carry emotional burdens silently, not realizing how deeply stress affects the body. A simple worry before bed can heighten nerve activity and make nighttime cramps more frequent or intense. All these factors create the perfect environment for stronger cramps after 60. But the important truth is this: these changes do not mean the body is breaking down. They simply mean the body needs different kinds of care than it did in earlier years. When seniors understand the real reasons behind worsening cramps, they feel empowered rather than discouraged. They realize that these symptoms are signals, not setbacks, and that with the right habits, the body can still respond beautifully. Medications that trigger nerve-related cramps. As we continue exploring why cramps become more intense after 60, there is another layer many seniors overlook: medications. For countless older adults, leg cramps are not just a muscle or nerve issue. They are a side effect of the very medicines meant to protect their health. And because these changes are subtle, many seniors never realize their prescriptions are playing a role. One common group is diuretics, often used for blood pressure or heart conditions. These medications push fluid out of the body to reduce swelling or strain on the heart. But with that fluid loss comes a quiet loss of minerals, especially magnesium and potassium. When these minerals get too low, nerves begin to fire more rapidly and muscles lose their ability to relax smoothly. Seniors often tell me they drink plenty of water, yet their cramps keep returning. They do not realize the medication itself is shifting their mineral balance. Statins, widely prescribed to protect the heart, also create complications for some people after 60. These medications work beautifully for cholesterol, but they can irritate the muscles in a way that makes them more sensitive to nerve signals. A muscle that has even mild irritation becomes far more reactive when a nerve misfires. Some seniors describe it as a deep ache that occasionally tightens into a full cramp. Others say the cramps began only after their statin dose increased. Blood pressure medications called beta blockers can affect circulation as well. They slow the heart rate to reduce strain, but in doing so, they may slightly reduce blood flow to the legs and feet. For a healthy young person, this is hardly noticeable, but for someone over 60 who already experiences slower circulation and tighter muscles, the difference can be enough to trigger nighttime cramping, especially between 2 and 5 in the morning. Even medications for diabetes can shift electrolytes. Some of these drugs help control blood sugar by encouraging the kidneys to release glucose in the urine. Along with that glucose, electrolytes may also be excreted. Seniors often do not connect their blood sugar medications to their cramping episodes, but the body feels every small shift. I once cared for a patient who struggled with severe leg cramps every night for nearly a year. She tried stretching, hydration, warm compresses, and every home remedy she could find. Nothing helped. When we reviewed her medications, we discovered that one of her newer prescriptions was subtly lowering her magnesium levels. After a small adjustment by her physician, her cramps decreased by nearly 70% within a month. Suddenly, she was sleeping through the night again. Stories like hers remind us how intertwined the body's systems are. Medications are essential and often life-saving, but they can create hidden ripple effects, especially in the nerves and muscles of older adults. The goal is never to stop these medicines suddenly. The goal is awareness. When seniors understand how their prescriptions influence nerve activity and circulation, they feel more in control. They know what questions to ask and what changes to monitor. Knowledge does not replace medical care, but it empowers seniors to partner with their doctors. It helps them recognize that their body is reacting, not failing. With the right guidance, adjustments, and habits, relief becomes possible again. How sleep, stress, and posture influence nerve signals. As we move deeper into understanding why so many seniors experience nighttime leg cramps, it becomes impossible to ignore the role of sleep, stress, and simple body posture. These are not small details. They shape the environment your nerves operate in every single night. And for adults over 60, these factors can quietly push already sensitive nerves into overreaction. Sleep is the body's time to repair and restore, but it is also the time when nerves become most vulnerable. When you lie still for hours, circulation naturally slows, especially to the lower legs. Muscles cool down, and cooler muscles respond more intensely to nerve signals. A nerve that is already irritated from early neuropathy or mineral imbalance can misfire with even the slightest stretch, turning a gentle movement into a sudden cramp that jolts you awake. Many seniors tell me they fear stretching their legs in bed because they know the cramp will hit the moment the muscle lengthens. Stress adds another layer. High stress does not always show up as anxiety or worry. Sometimes it appears quietly through hormones that reduce the body's magnesium levels. Magnesium is what keeps nerves calm and stable. When levels drop, nerves fire too quickly, too loudly, and too often. Seniors who describe themselves as tired but wired, or who wake up frequently during the night, often have this underlying pattern. Their nerves are operating without the buffer they once had, and the result is tension that builds all night long. Posture also plays a surprisingly powerful role. The positions we fall asleep in become the positions we stay in for hours. Many seniors naturally sleep with their toes pointed downward. It feels relaxing at first, but over time, this posture shortens the calf muscle. A shortened muscle is primed for cramping, especially when combined with slower nighttime circulation and sensitive nerves. Some seniors bend their knees too tightly, compressing the nerves and vessels behind the knee. Others sleep on soft mattresses that cause the hips to rotate in ways that put the legs under constant tension. Even mild overnight dehydration contributes. Breathing alone causes the body to lose water. Seniors who do not drink enough during the day often wake up in the early morning hours with muscles that feel dry, tight, and ready to seize. These patterns are subtle, but they are powerful. When you look at them together, it becomes clear why so many seniors describe the same 2 to 5 a.m. cramping window. The body is colder, circulation is slower, hydration is lower, stress hormones are still active, and posture has been fixed for hours. It is the perfect storm for nerves that are already struggling to stay calm. The reassuring truth is that small adjustments can make nights dramatically better. When seniors learn to support their nerves through better sleep habits, gentle pre-bed routines, and mindful posture, the entire nighttime landscape changes. What once felt like a nightly battle becomes a quiet, restful early warning signs that your leg cramps are nerve-related. One of the most important lessons I have learned in decades of caring for older adults is this: nerves whisper long before they scream. And when it comes to leg cramps, seniors often miss the earliest warning signs because they seem so small, so ordinary, so easy to dismiss. Yet these little clues are the body's first attempt to communicate that nerves are being stressed, irritated, or deprived of support. Many seniors tell me their cramps started subtly. Maybe it began with one leg tightening more often than the other. A one-sided cramp is one of the earliest signals that the nerves in that leg may be struggling. Muscles do not cramp unevenly without a reason. When one leg behaves differently, it is often because the nerves in that limb are experiencing early dysfunction or reduced blood flow. This is especially true if the cramp always returns in the same spot. Another early sign is when cramps come bundled with tingling or burning. Seniors often describe it as a warm buzz under the skin or a little spark shooting across the toes. These sensations may happen long before pain appears, and they indicate that small nerve fibers are misfiring. They might still be alive and functioning, but they are irritated and unstable. If the tingling or burning comes and goes unpredictably, the nerves are trying to get your attention. Some seniors notice their toes curling without their permission. They wake up with their foot locked in a position they did not choose, or they feel the toes pull inward when the cramp hits. Involuntary toe curling is a hallmark sign that nerve communication to the foot muscles is misfiring. It is subtle, but it is meaningful. Slow healing is another sign seniors tend to ignore. A tiny scratch on the shin that takes longer than usual to fade, or skin on the feet that begins to look shiny, thin, or unusually dry. These changes reflect early vascular and nerve compromise. When nerves are not fully nourished, the skin they supply loses some of its natural resilience. It is the body's quiet way of saying circulation is no longer reaching the tissues the same way it used to. Then there is the pattern of cramps that appear during walking and disappear at rest. Many seniors blame this on overexertion, but when walking triggers cramping, it is often because the nerves and vessels are under pressure. The muscles are asking for oxygen and the circulation cannot keep up. Once the person stops walking, the demand drops and the cramp eases. This is one of the clearest early warning signals that nerves and circulation are beginning to struggle together. Individually, each of these signs can be brushed aside. But together, they paint a picture of nerves that are working harder than they should. These early signals are not here to frighten you. They are here to guide you. They tell you that your body is still communicating, still responsive, still asking for care before damage becomes permanent. When seniors learn to recognize these quiet warnings, they often prevent years of worsening discomfort. Awareness becomes the first step toward healing. And the sooner someone understands these early signs, the sooner they can take gentle, effective steps to support their nerve health. Daily habits that quietly damage nerves. After 60. The truth is, nerve health rarely declines overnight. It fades quietly, shaped by small habits repeated day after day. Many seniors are surprised when I explain this because so many of these habits feel harmless. They do not hurt in the moment. They do not cause dramatic symptoms. They simply chip away at nerve stability until one day the body begins to send unmistakable signals, often in the form of leg cramps. One of the biggest culprits is long hours of sitting. After 60, leg muscles already lose strength and flexibility more easily. When someone sits for most of the day, blood flow to the lower legs slows dramatically, and nerves receive less oxygen and nourishment. Seniors often tell me they sit to rest, not realizing that their nerves are quietly being starved of circulation. Even short periods of gentle movement throughout the day can prevent this decline. Evening habits matter too. Many seniors enjoy a comforting, high-sugar meal or snack at night, not realizing how strongly this spikes blood sugar during sleep. These nighttime spikes irritate small nerves, especially those in the feet and calves. When nerve fibers are exposed to repeated sugar fluctuations, they become more sensitive and more likely to misfire. Seniors often think they are having normal nighttime cramps, when in reality, their nerves are reacting to hours of elevated glucose. Hydration is another habit that changes with age. I meet many older adults who drink very little in the morning but try to make up for it at night. They believe they are hydrating well, yet their nerves and muscles spend most of the day underhydrated. Nerves rely on steady fluid balance to fire normally. When hydration is inconsistent, nerve communication becomes unstable. This is one of the biggest reasons cramps strike between 2 and 5 in the morning, long after the body has been quietly drying out. Lack of stretching is another factor that surprises many seniors. After 60, muscles stiffen more quickly, especially the calves, hamstrings, and small foot muscles. When muscles tighten, nerves have to work harder to communicate through restricted tissue. Many seniors say their legs feel heavy or tight during the day, but ignore it. Over time, the stiff muscles pull on nerve pathways, making nighttime cramps more likely. Footwear habits also play a role. Tight socks, rigid shoes, or slippers with no support reduce circulation around the ankles and compress nerves that run into the feet. A simple choice, like wearing loose, supportive socks or choosing shoes with proper arch support, can immediately ease the load on small nerve fibers. Then there is the habit of walking only occasionally. Many seniors take long walks once or twice a week, thinking they are staying active, but their nerves need frequent, gentle movement rather than rare, intense effort. Long gaps between activity allow blood flow to stagnate. When someone suddenly walks a long distance after days of inactivity, nerves can flare and cramps appear more easily. What nerves truly love is consistency, not intensity. Even stress finds its way into this picture. Chronic worry or emotional strain reduces magnesium stores and keeps the body in a heightened state. This makes nerves fire more quickly and recover more slowly. Seniors often tell me they feel their cramps worsen during stressful seasons without understanding why. Their nerves are simply reacting to the body's internal tension. The important truth is this: none of these habits define you, and none of them are unchangeable. They are patterns, not permanent problems. And the moment someone begins shifting even one of these habits, nerves begin to feel relief. When seniors realize that small, daily choices can either strain or support their nerves, they suddenly feel empowered. They understand that healing does not require huge effort. It requires awareness and gentle consistency. What seniors can do today to protect their nerves. When seniors reach this point in our conversation, they often ask me the same question. If nerves are already irritated, is there anything I can do now to calm them down? And my answer, every single time, is yes. Healing is not only possible, it begins much sooner than most people expect. Nerves respond beautifully to small, consistent acts of care, and the steps that make the biggest difference are surprisingly gentle. One of the simplest things you can begin tonight is a brief calf stretch before bed. Your calves are home to some of the most active nerve pathways in the lower legs, and when they stay tight throughout the day, nerves become more reactive. A slow, steady stretch helps the muscle release tension and gives those nerves room to breathe. Many seniors tell me that after just a week of stretching, their cramps become less intense or stop waking them altogether. Light walking after meals is another powerful tool. You don't need to push yourself or aim for long distances. Even 5 to 10 minutes of walking helps stabilize blood sugar, improves circulation, and sends nourishment to the very nerves that control your lower legs and feet. I have seen countless seniors reduce both cramps and neuropathy symptoms simply by adding a short stroll after dinner. Adding magnesium-rich foods in the evening can help relax overactive nerves. Almonds, spinach, pumpkin seeds, and dark leafy greens offer gentle, natural support. Your nerves use magnesium to steady electrical signals, and many older adults do not get enough of it. When your evening habits nourish your nerves rather than exhaust them, your body begins to settle into the night more peacefully. Hydration throughout the day matters too. When seniors shift water intake toward morning and afternoon, nerves stay steadier by bedtime. This one change often reduces both cramps and nighttime restlessness. The goal is consistency, not volume. Nerves respond best when hydration supports them hour by hour, rather than arriving all at once. Keeping your feet warm also plays a surprisingly important role. Warmth improves circulation, allowing nutrients and oxygen to reach the small nerve endings in your toes and arches. Soft socks or a warm foot bath before bed can help nerves unwind and stay calmer during the night. For anyone living with blood sugar fluctuations, monitoring trends can reveal patterns you may not have noticed. Cramps that follow high sugar evenings often point to developing nerve sensitivity. Awareness is not something to fear. It's a tool that helps you make choices that protect your nerves rather than strain them. There are also moments when medical attention becomes essential. If numbness grows, if burning sensations spread, if cramps strike only one leg or a company color changes in the skin, or if swelling appears, those signals deserve a professional evaluation. Seeking clarity early allows nerves to heal sooner and prevents more serious complications from taking root. What I want seniors to understand most is that nerve health is not a mystery. It is responsive, it is adaptable, and it continues to heal even late in life. The steps that help your nerves now do not require force or perfection. They require compassion toward your own body. The more you listen to these early signals, the more control you regain over how your legs feel each day and each night. As we come to the end of our time together, I want you to take a quiet breath and remember something important. Leg cramps do not mean your body is failing. They are messages, gentle ones at first, trying to guide you toward the care your muscles and nerves have been asking for. Your body is not working against you. It is communicating with you, whispering long before it ever shouts. Your legs have carried you through so many chapters of life. They have supported you through long work days, grocery trips, walks with loved ones, raising families, facing challenges, and celebrating joys. They have taken you through seasons of strength and seasons of change. They deserve compassion. They deserve to be honored. And so do you. What I want you to hold on to is hope. Even after 60 or 70 or 80, your body can still shift and heal in beautiful ways. Nerves can calm when they are nourished. Muscles can relax when they are stretched with kindness. Circulation can improve when you give your legs small movements throughout the day. Healing does not require force. It requires consistency, patience, and belief that your body is still capable of responding. You have more power than you think. Drinking water earlier in the day, stretching gently before bed, walking after meals, warming your feet, paying attention to small signals instead of dismissing them, choosing foods that support your nerves and muscles. These little choices create real change. They are acts of self-respect. And you are not doing this alone. At Senior Health Daily, I walk with you. Every step, every question, every moment of courage. You have a partner on this journey. Your body still listens, it still responds, and it still wants to carry you forward. Thank you for being here with me today. Take care of yourself, honor your body, and stay close to Senior Health Daily for guidance, hope, and strength.